gosh, there is a God.
Okay.
Thank you so much, everyone, for your patience. Yay. Okay, yes. All right, so anyway, what is palliative care? Thank you so much for your patience on this. So for the most part, what is interesting when I'm speaking to everybody out there in the community that has joined us today, many people don't use the word palliative. I mean, for the most part, people only want to deal with words that they use all the time. And so palliative is not a word that people use very often, but it is, for the most part, a very trending word now, and it is a specialized type of care for those who are dealing with a serious illness. The serious illnesses are a pretty wide span of different diagnoses, but in particular for this presentation here, the illnesses that we are going to be focusing on are cancer, any type, any stage, COPD, congestive heart failure, and kidney failure as well. Anyway, with those particular diagnoses, there's always treatment that are associated with those illnesses. And those treatments create some really horrific symptoms. And thus, palliative care enters the scene, because palliative care is a type of care that provides relief of these symptoms that happen because people are taking these treatments, these curative treatments, in hopes that they can extend their life as well as boost their quality of life and possibly cure their illness. What we found is oftentimes, if they are unable to cure their illness, there is so much discomfort with dealing with the symptoms of their treatments, and thus palliative care is here. And palliative care is the main reason is to boost the quality of life for a patient that is dealing with these serious type of illnesses, as well as help the family. So the illnesses that I did bring up, the cancer, CHF, COPD, the kidney disease as well, can occur to people of any age. And I think a lot of people didn't realize that we can even help children as well. And so coming to a presentation like this, you'll be able to learn all of the different reasons that palliative care is so important to us today. The other thing too is that when people are dealing with these illnesses such as cancer, and they're having chemotherapy or radiation or even surgery, there is and continues to be a lot of pain associated with that, as well as nausea and other things. But also there are a lot of emotional things that happen to people where they become depressed because of the pain that they have to deal with day in and day out. I mean, if you could imagine having 24 hours of a really horrific toothache, I mean, it would be maddening over time, right? Well, this is what happens with palliative care, and oftentimes there is no relief, but palliative care focuses on relief. Do we have a question that came up?
Yes, it says, click online diary. Dictionary defines palliative as relieving pain without dealing with the cause of condition.
Oh, okay.
Thank you for that
Very
definition.
Thank you very much that you had that definition just handy for us. Thank you. Yes, I appreciate that. So the difference with palliative care too is that people do not have to have a terminal diagnosis. So unlike hospice care, those who are in palliative care are continuing to do all types of treatment, curative treatment if they wish. Also, we find that people that are on palliative care are still leading quite a active life. You know, they're still going to Vegas, they're still attending football games to watch their grandkids play. They're still doing quite a lot of things. And so as a result, trying to maintain a person's quality of life when they're dealing with these different discomforting symptoms can be a challenge. However, here we are, we're on the scene, and we are providing that kind of specialized care as well. Tish, if you have somebody that has a comment, just let me know so that I can let them in.
Right, I will. Thanks, Lani.
Okay, awesome. So, signs that palliative care is needed. The reason I put this up is because I want people to know that there are physical signs that you can see that will indicate to you that, hey, maybe my loved one or myself could really benefit from palliative care. So if you find that you or your loved one tend to go to see the doctor quite a bit, and when I say quite a bit, I'm saying like a few times in the month for something that's ailing you, or maybe more than one reason for discomfort, but also going to the emergency room, calling your doctor at different times of the day and night, or even on weekends. The fact that you're reaching out because you would like some kind of relief more than a few times during a month would definitely signal that you may need palliative care, particularly if you are being challenged by the specific illnesses that I mentioned. So, difficulty managing medications. I'm going to talk about that a bit more in the benefits of palliative care. But yes, many times people are getting medications from many different sources, and after a while, it's quite confusing as to which one they should take. And so that's a physical thing, though, that you can see when somebody is in quite a quandary of trying to decide whether or not they're supposed to take which or what medications that day. The other thing that really starts to show up is the diminished activities of daily living. So, people who do manage a checkbook, I mean, I don't know, I haven't seen a checkbook for so long, now with the debit card, but I'm just saying that for those that go and actually, try to balance their checkbook, after a while, they can't remember how to do it. They become very foggy in their mind on, did I buy that? Did I enter that in, etc. Even driving, the way that they respond to driving is not as, say, sharp as they used to be. Grocery shopping, finding themselves in a store and not knowing why they're there, or even preparing meals where they're unable to prepare the meals for themselves. And so somebody either has to come in or a family member does step up to make those meals. And it's difficult for them to even clean up around the house. And when I say light housework, I'm talking about, just doing the dishes or throwing in a load of laundry or something. It becomes difficult for them to do that. Other things that start to become noticeable is there's pain, there's fatigue, there could be swelling in the feet and legs, and of course the discomfort of nausea. And there are other emotional problems that start to show up, one being of anxiety as well. Now, people will ask me, when is the best time to sign up for palliative care? When I speak to Dr. Dolan, she will always recommend that people sign up at the time of diagnosis. And the reason she says that is because, the idea of receiving palliative care when you're still feeling fine just seems so foreign to everyone. But if you don't really understand what palliative care is, it's good to kind of get into the pool and put your feet in the water on the shallow end of the pool, so you can kind of get to know your palliative care team and understand the natural progression of your illness. Many people, I know it might seem shocking, but they don't really know about the disease that they're dealing with or illness, and no one has ever told them. So it is one of the great benefits from a palliative care team to be educated by them regarding the illness. Okay, is there somebody that's asking a question?
I don't see any right now, Lani. We just had one other person join us.
Okay, welcome. Yay, welcome. Thank you so much for joining us. All right, I'm going to continue. So throughout the course of the illness, sometimes there can be serious medical issues. And by signing up early, people can get those issues answered along the way. A lot of times people will tell me, oh, well, you know what, my grandmother has had COPD for 20 years, and why would she need palliative care now? Well, as the illness progresses, there are going to be other challenges that come up, and for us to already be on the scene with the family and the patient will just make the transition of dealing with these symptoms so much easier. So when somebody signs up for palliative care, then what happens is our registered nurse will visit them at home, will give them a evaluation of their current health condition as well as their medical history. But the real reason that our nurse goes there is because the nurse wants to find out what is the patient's biggest concerns. What I love about palliative care is it really addresses the human side of illness. We're not looking at just, oh, so you can't sleep at night, or you're not eating well, or maybe you're dealing with constipation or something. Yeah, we're going to get to all of those physical ailments, but truly, we want to know from a holistic standpoint, what are your biggest concerns? And your biggest concerns, for example, could be, I hope that I'm well enough. I want to be well enough so I can go on my Disneyland reunion trip with my grandkids and my kids. Or something more simplistic as, I just want to be able to go from my sofa to my mailbox outside without becoming completely and totally exhausted. I mean, it could be as simple as that. But the bottom line is, we want to know what's important to you, the patient, or your loved one. And that really is the catalyst in which we center all of our care. So a plan of care is created, but it has a lot to do with what the patient's wants and needs are, as well as the families. And so in order for us to work together as a team and collaborate with the family, we need to educate the family and the patient as well. So some of it will have to do with the medication review, and others is just your natural lifestyle. So in other words, somebody will say, oh, I can't really breathe, and I seem to have swelling up in my feet and my legs and etc. So then we take a look at the diet first and find out what you're eating. So maybe you can't eat that spam every single day. We might have to make some alterations on that. But it's those kinds of things where maybe you've been eating that all your life with Vienna sausage and all that. I mean, we're not poo-pooing that at all. All we're saying is now there has to be some lifestyle changes that will help you achieve the goals that you shared with us. And when I show this with regard to the medication, I don't know if some of you or all of you can relate to this, but what we find when we go into people's homes is that when a patient goes to visit their primary care physician, they are oftentimes given a prescription of several different pills. Okay, so they already have maybe 5 or 6 different pills that they're given. But say there's an event of some sort and they go to the emergency room. Well, they get some more medication on top of that. And then, they go to see their cardiologist or whatever ologist that they're going to see, and they get some more medication. And then something might happen and they go to urgent care and they get some more. So what ends up happening is, like this mountain of medication that you see here that the couple is dealing with, we have gone into homes where people have had more than 50 jars of medication on their coffee table. Now, some of it belongs to the deceased ex-husband. Others could be for their adult children that no longer live in the house. There's a portion of it that is also expired. And then they keep all of it because it costs money. And irregardless of whether it's still valid for them or not, they still keep it. What is the danger of it is we find that, number one, over time they start to become novice diagnosis people, where they say, oh, well, you know, I have a pain in my lower back. I think I'm going to take this one because Doris took that one 2 months ago. So I think I'll just go ahead and take that. There is a danger, obviously, in that, because if they start playing around with their medication, obviously they could take the wrong medication. But we also find that because they have so many jars of medication, when we go and we take a inventory of all the medication they have, and then we go ahead and we call your primary care physician and we let him or her know, we are able to reduce the amount of medication that they are currently taking. Like maybe some patients are taking anywhere from, 20 to 28 different medications during the day. Maybe after speaking to the physician, we're able to reduce that to 13 different medications. Yes, 13 is still a high number, but it's so much less than what they were taking. We also find that there's a percentage of a discomfort that they were dealing with that immediately goes away once we line up that medication. So anyway, this is one of the major benefits that occurs when our palliative care team comes in on the scene and goes to someone's home. Pain and symptom management is also some of the very, very critical work that the team does for the patient as well. And the care coordination is also important. Sometimes our registered nurse will actually accompany our patient to their doctor's appointment. And the reason that that happens is because many of our elderly patients have been raised to be very, very good patients. Very good patients means that we need to go into the doctor. We do not ask the doctor any questions, and we need to be out of there within 6.5 minutes. So if you're going to ask a question, we're going to have to give you the stink eye so that you stop asking the doctor these questions. So what ends up happening is when our registered nurse goes in with the patient, then the registered nurse is able to gently suggest things such as, Mrs. So-and-so, why don't you go ahead and share with the doctor what happens to you in the night? And then the patient will say, oh no, it's nothing, that's not important. I don't need to share that. And then the nurse will continue to encourage the patient to go ahead and share that she actually falls every few nights on the way to the restroom, and she doesn't know why that happens. Now that is a full red flag to the physician at that moment, who is then going to take a closer look now at truly what is going on with Mrs. And so this is why I'm saying that we become an extension of the primary care physician in a way that is not possible without us providing care like this where a person lives. Oftentimes, the doctor only sees the patient within the few short minutes that they're in the room with him or her. And so he doesn't know, or she doesn't know, that at home there could be a hoarding situation where there are aluminum cans and newspapers all the way up to the ceiling, or there is a situation where there's poor lighting in the home, or there's rugs everywhere, or there's a lot of uneven surfaces. So that's why the patient falls quite often at home. Maybe the doctor doesn't know that there is no running water at someone's house, or that there are 25 cats that live in the house with the patient, or that there's 6 pit bulls in the front of the house, and so as a result, no one can come to visit them. Tish, was there something that you?
Not yet, Lani.
Okay, all right. So you go ahead and raise your hand because I see that people are coming in, but I don't know if they are asking a question at that point. So you just go ahead and raise your hand and I'm just gonna keep on going. Okay, so
We'll let
that's
you.
why I'm saying, oh, was there a question?
Oh, no, no, I'll let you know.
Okay, so that's why I'm saying that with our palliative care team, being extension of the primary care physician, we are able to put the patient right at the very center of care and really pull all of the resources together and link arms in care that patients had not received prior to a program like this. So we're quite excited about providing palliative care to the serious ill people that are out there in our community. The other thing is, besides our registered nurse on the palliative care team, we also have a licensed social worker that will come to the home. We find in palliative care that besides the discomfort that people experience because of the treatments they're getting, there are a lot of emotional concerns that happen with our patients as well, where they fear is also one of the major ones, as well as anxiety, and people can't sleep, and just there's all kinds of things that occur. And so our licensed social worker will come into the home and help address those issues that may come up. And it's not only for the patient, it may be something that is occurring for the family. Understand that these serious illnesses are family illnesses. It is occurring to one person who is experiencing the illness as well, but everybody in the entire family is affected by this illness. And so it's so important for our social worker to come in and really embrace that with the family. The social worker can also help with any of the insurance forms. Sometimes people need to sign up for Medicaid, or they may need other insurance help. So our social worker is able to do that, as well as connect them to different resources within the community as well, such as a food basket or other types of boys and girls club, because maybe the grandkids could use some of that support as well. It's pretty widespread, and it's such a great resource to have. And also, it's good for us to check on all of our patients that they do have an advanced care directive. And if not, our social worker is right on the scene to make sure that that is taken care of. Sometimes there are patients and families that also need some spiritual support, and we are able to provide that if that's needed. Now, many people will say, okay, so how is palliative care paid for? Because it's not a package deal like hospice. You're absolutely correct. Palliative care is paid for by the commercial insurance that people may have, as well as Medicare. However, if there is no other supplemental insurance, such as Medicaid or HMSA, supplemental Akamai Advantage or something like that, there could be a copay. So that's important to know and to ask when somebody has or signs up for palliative care. Normally, the copay would be similar to that of a doctor's visit. If people go to the doctor and have a regular visit, the copay normally occurs when somebody on the team, such as our licensed social worker or our nurse practitioner, comes to visit them. And there could be a copay depending on the insurance that they currently have. Okay, so I'm going to move right into hospice care. Tish, our question is all with hospice care at this time?
I will do another poll, Lani, and it's a little mix. So I am going to pull that
Oh,
poll.
Is
Uh,
that poll with hospice questions as well?
yes, it is.
Okay, so we'll just wait on that, and
Okay,
we'll wait for that. We'll wait for that screen prompt to come up, and then we'll do it at that time.
sounds
Are
great.
there any questions with regard to palliative care? That was a lot of information that I provided for you folks. And if there's anything that you're thinking about now, we're going to have a question and answer session at the end of this presentation in a few moments. So if there isn't anything that's coming to mind now, we can absolutely take care of that towards the end of the presentation. So hospice
Lani,
care.
sorry, excuse me, Lani. I think there are some people on a telephone Zoom in, so they are unable to use the chat box. So I just wanted to give a few brief moments. If anyone that is on a telephone call into Zoom and you had any questions on palliative care, if you are comfortable, you could please unmute yourself and ask that question. Okay, I think it's time for everybody to take one deep, great breath, and we'll start with hospice care. Thank you, Lani.
Thank you so much, Tish. That's really great. Okay, so we're moving on to hospice care. People will always ask me, what's the difference between hospice care and palliative? Okay, so in the umbrella of healthcare, palliative care is a very, very broad umbrella. And hospice care is actually under that umbrella. It's a subset of palliative care, but it's very, very specialized in its type of care as well. So the reason that it is a little different from just the palliative care that I was sharing with you overall is that hospice care comes with a specific type of philosophy. So unlike palliative care, where everyone is just going after the relief of things, and we are trying to help boost their quality of life, hospice care is focusing on the person very much more so than the disease. And it's because we're trying to keep the patient as comfortable as possible. We are also focusing on the quality of life so much more than the quantity of life. Okay, so let me give you an example of that. So say somebody is told, okay, well, if we give you these 3 more treatments of chemotherapy, you could live longer. Although there are quite a few setbacks with regard to discomfort with regard to continuing these types of treatments. And so when people sign up for hospice care, they are now letting go of, oh, I'm going to keep trying to do these heroic treatments in hopes that it might extend my life. Because at that point, they just want to look at the quality of life and just be comfortable. So no longer dealing with that and feeling that that's the trade-off that they have to make in order to live their life fully. Was there a comment?
I just got one in. Do I stop seeing my regular doctor if I am on palliative care?
Helene, would you like to answer that one?
No, you do not have to stop seeing your physician. This is a support, so more help coming into your home. And I think that I think it's very important that we continue to see our physicians. And this, again, is just supplemental support for you and your family.
Thank you, Helene. Is there any other questions?
Not at this time.
Okay, let's continue. So this is the thing about hospice care, and it is that people that sign up for hospice care, please understand that death is not a requirement. Okay, and also really what hospice care does is the purpose of hospice care is to come in and try its best to ease terminal suffering. See, people do not need to suffer as much as they do, and largely it's because they are not signing up for the Cadillac of services, which is definitely hospice care. And as I continue, I'll explain that even more. But as part of hospice care, it also really addresses the emotional and spiritual stress that people often deal with when they're dealing with an end of life disease. And the different pains that we address in hospice care are 5 different pains. The physical, which is the obvious, tell me 1 to 10, how much does it hurt? Of course, the emotional pain as well, where, gosh, I can't sleep. I'm worried so much. I'm afraid. All of those types of things. And then there's financial pain too, where people are just so afraid that, if something happens to me, are my family going to be okay? Will they be able to live in this house? These kinds of pains are definitely causing somebody a lot of discomfort. There is the spiritual pain of, oh, I wish I told my father that I loved him before he passed, or, oh, when I'm sleeping, I can hear my adult children complaining over the land. I wish they would stop it. There's so many different types of pain that we are addressing when we come to address the whole person. And finally, the 5th pain, the pain of isolation. There are so many times a person is living this very social life. They go to quilting class, and after that they have their senior socials, etc. And then all of a sudden, now they're dealing with an end of life situation, and nobody comes to visit them anymore. They are unable to drive. Nobody takes them out to visit others, and that isolation is very real. So although we may be helping somebody with medications, we need to also address these other pains that are really challenging our patients as well. So,
oh, sorry, Lani, I got one more question. Okay. This might be for Helene as well. Why do you think palliative care has really been emerging in our healthcare system, as I haven't seen it around before?
This is an excellent question. Lani, I can take this one.
Okay.
Palliative care is actually new. It's a new medical specialty. The vast majority of medical schools across the country have palliative care programs now that did not exist 10 years ago. And so the medical students and residents are now learning more about palliative care. So with this movement that came across the country 10 years ago, before that, there was no education surrounding the impacts that this illness causes for the patient and the family. I honestly believe that palliative care was missing from the traditional medical model. And I kind of would like to talk or just share a story with you from a friend of mine, and her name is Mary. And she told me the day in the life of a young teenage girl with a very serious illness. After she explained that she took up residence in a local hospital for a total of 4 months, she expressed the loss of living a normal teenage life, a normal high school life, to think of it that way too. She asked, is there a better way? And I really think that the healthcare industry heard the patients and they said, there's got to be a better way. And then we start seeing palliative care coming into play. And I just remember the movie of The Wizard of Oz, when Dorothy said, there's no place like home. And home can really be a place where palliative care will focus more broadly on improving life and providing comfort for people of all ages with serious chronic or life-threatening illnesses. And I think the takeaway here is that palliative care, our team members are focused and concerned about you, the patient, and not just the part of you that is sick.
Awesome. I have one more follow-up. Do you need to be homebound to receive palliative care?
No, you do not. Great question.
Oh, I have one more. If my serious illness is curable, will I still need palliative care?
I'm going to say yes, absolutely. As the patient is going through treatments, the side effects are causing suffering, and this suffering and disease burden does not need to take place. We can really help with that, and palliative care is here to ease those storms.
Right. I just had another question. Someone is asking, my nephew is 7 years old and just got diagnosed with cancer. Would he be able to sign up for palliative care, and why?
Yes, he can. He can sign up for palliative care. And the reasons why here is that as this child is going through this treatment, there's going to be symptoms and burden symptoms, to say the least there, that palliative care can really help ease on that those symptoms that do present themselves. And it's not always to go straight into the hospital, especially when you have cancer and your white cell counts are really, really low, meaning that you can't defend yourself against the germs that are out in the community. So being able to have someone come to you and decrease the chances of being exposed to things when your immune system is so low is very, very valuable for this child. Thank you.
Helene, another question. Is a caregiver required to receive palliative or hospice care?
Is a caregiver required to receive palliative care?
Palliative or hospice care?
A caregiver. So they're not required to receive palliative care, but I can tell you, as far as can palliative care help this caregiver or this family member? I got a question that came in prior to the presentation today, and Tisha, if you can show that photo, I'd like to start with that if you can.
Yes, definitely. Can you all see that?
Not yet.
Okay.
I think Lani needs to stop sharing, maybe.
Oh, okay. Okay. Thank you, Helene.
No stress.
Okay.
So,
Yeah, there you go.
When a person, this may look like someone very familiar to you, but when someone is diagnosed with a serious illness, this person has a lot of burden, a lot of questions that need to be answered, a lot of feelings and emotions. And Tish, if you can take it to the next picture.
Yes, I can.
And while she's putting up that, the person is going through their own turmoil. And sometimes there's the rest of the family and that are trying to understand, why is this happening? How come this is happening to whoever this person is? And sometimes they feel like they have to be strong for the one going through whatever that diagnosis is. And so they are silently suffering. And this suffering is not good for this family unit, and it does have harmful outcomes. Palliative care has a mission to encircle around this family and give them the opportunity to put words to the feelings. And I want everyone just to remember that suffering is bad for our health. It's bad for our relationships. It's bad for our family units. And so allowing the support to come in during this time is so important to help being able to express those feelings as things are taking place. Thank you. Back to you.
Thank you so much, Helene. Let's see. I have another question that just came in. Do hospice patients need to accept spiritual care from Hawai'i Care Choices if they already have a strong spiritual support from their church?
This is a great question. So I remember the days when I first started in hospice, and I would hear this question a lot saying, you know, I'm already well connected with my church. So in those situations, our spiritual counselors are not clergy. They don't replace those things, but they allow for additional support in the home. So while your church group may happen only once a week, you may have additional support in the home. They're not there to convert or to preach, so to speak, but just to be an additional listening ear to see how everything is going.
That is so great. Thank you, Helene. Okay, I don't have any questions that came in yet. Lani, if you want to, oh, sorry, I do have another question. Does palliative care preclude aggressive treatment? It's a great question.
That's a great question. Palliative care does not stop you from seeking curative care. So if you are interested in having, for the instance of my friend who needed to have rounds of chemotherapy, she that was part of her journey, and then palliative care would come in and be supportive of those symptoms that come in as well with the treatment. So.
Okay, thank you. I have another one. For hospice care, my brother remained with that care for 2 years before he passed. But I thought hospice care is only provided 6 months or less.
Great question. That is true, that hospice has a time frame of 6 months or less. However, this is the great thing too, is that it has been proven time and time again in many articles and studies that hospice care actually can extend life with that quality, compassionate, ongoing care that comes to your home. The hospice benefit under the Medicare program guides the hospice team with eligibility standards. So no one follows only one path, right? We all have our own little path that we take. So, and also remembering that the timeline is not within our hands, right? So being able to allow nature to take its course, and we're here to support.
Thank you, Helene. Another great question I have. When my grandma was dying of cancer, she was always in a lot of pain, and my grandpa said that hospice would knock her out, heavily medicating her. So we did not sign her up. I watched her suffer a lot. So what is the truth about medicating your patients?
Oh my goodness, that just hits right here, doesn't it? I'm so sorry to hear that you witnessed such a hard time in your grandma's life, and the surroundings of that suffering. I can just see the picture in my head as you're asking the question there, Tish. But medication is only one tool in our medical bag, and hospice is not a one-size-fits-all kind of a program. It truly is individualized, and I'm going to speak directly to the situation because this scenario is so common to something that happened to me when I was young, when my grandma went through the same thing. And a lot of our family members were just not wanting to use the pain medication. And it was so hard to see when it was time to move grandma up in bed. She would scream because it was so painful. And then finally when hospice came in and they were able to do education and develop a plan of care and use what's in our medical bag, so to speak, where we can not only give medications, but there's also non-medicines that we can use to help alleviate this suffering too. And then the other piece is finding out the why. Why is grandpa worried about this medication? Is there a worry about addiction? Is it worried about she wouldn't be able to communicate with the family? All those things help draft a picture in our head, or paint that picture in our head, so we can tailor the services for what their goals are. And I'm really sorry that happened with your grandma. And again, I think there's so much that we can do in those situations too.
Thank you so much, Helene, for answering that really, really well. Lani, if you don't mind, I was just going to take this time to do our second poll
Okay.
so that everyone can go ahead. Okay, I'm just going to go up here. Let's see. Okay, this is our second poll, if everybody can see it. Are you seeing it on your screen, Lani and Helene?
Yes, yes.
Okay. All right, so there are 3 questions. If everybody will take a moment to get those answers in a bit. Again, no right or wrong questions here. No pressure.
Those were 3 great questions. Thank you, Tish.
You are welcome, Lani. While we're waiting, Helene, I did get another question in. I have had COPD for many years, and my doctor has never suggested getting palliative care. Where can I go to get that care, and how do I qualify for it?
That is an awesome question, because you're heading in the right direction, right? Because you've already identified that, hey, this could be something that is good for me. So you can contact our office, and our team will work with your physician and to assist with the needed items. And then to qualify, your diagnosis will need to be one of the 4, and you mentioned COPD, which happens to be one of the 4. So just call into our office, and our medical team will be able to help you, guide you right into the program.
Okay, that is great. I have 2 others that are still thinking about the answering some of the questions. Helene, if you don't mind, if I can ask you some of the questions, and maybe you can shed some light on the answers to that, or what you think. The goal of palliative care is to improve the quality of life for their patient and their family. True or false?
Say it one more time. The goal of palliative care
is to improve the quality of life for the patients and their families.
Absolutely. If there's a score of like true, absolutely. It's 100% true.
All right. The second poll question is, hospice is where you go in your last days. Is that a true or a false question?
It's a possibility. It's an option for you. So I think I would say yes, hospice is a great place to go. We do have patients and their families where their goals of care may be to continue with treatment and curative care, and that is that beautiful bridge with palliative care, and being able to have those open dialogues with the patient, their family, and listening to the patient and their wishes and wants. And sometimes that palliative care team can surround that family and remember that it could be grandma again in the situation that we had before. Grandma is saying, I'm ready to go home or something like that. And then having the family get behind that decision and support. And then hospice would be an excellent entry.
That is great. I was just going to go to another private question I received. Does this mean that I only will refer my grandma in the few weeks possibly prior to her death?
You know, hospice, the beautiful thing about this benefit from the Medicare program is that it identifies 6 months or less, right? And so as we spoke about earlier, we know no one of us has that, that crystal ball that says, yep, we're exactly at 6 months. And so it really becomes a conversation with the patient and the family. But what I can tell you that I hear majority of the time is that the families express after the loss of their loved one, I sure wish we had hospice sooner. And so I encourage people, it's always a good thing to look into. We can really ease some of that disease burden for sure.
I definitely concur to what Helene said as well, because when my mother was diagnosed with lung cancer, and her doctor came to us and said, your mom can have hospice care at this time. We had no idea what hospice care was. And when I went to her and had the conversation, she said that absolutely not. She was just this proud, stoic, pure Hawaiian woman that was just not going to have that. And so she said, no, I don't need that. Oh my gosh, I'm going to live so much longer. I don't need that. And so I said, oh, okay. So you're not about hospice care then? She goes, no. I said, okay, well, I heard that we can get free stuff. And then she said, oh, like what? And then once I told her that, her hospital bed and her oxygen and all of the medications, to her diagnosis was all included, she just could not believe it. In fact, she then said to me, oh, that's some kind of gimmick. Who's going to pay for that? That's crazy. And then when I told her that it was Medicare, she goes, oh my goodness, the government. Oh no, I'm sure there's a copay. And she was very suspicious about it. So I said, so Mom, why don't I go and check it out? And if it is for real, what do you think? She goes, oh, well, I mean, if it's for real, we should sign up if we can get it for free. So I went ahead and I checked into it, and absolutely it was all included as part of the hospice benefit. To have hospice at home, it was 100% included. And so at that time, my mom had been given the 6-month life expectancy. However, she lived well past that. And her comment about having hospice care was that, I'm so sad that Daddy didn't have that when he had passed away a few years prior to that from congestive heart failure. And it was largely because we did not know. So then my mother said, I want you to go out and tell all the neighbors about this wonderful hospice care. And I know they don't know, and no one is letting them, the government's not going to make sure that they know this. So you go out and tell everyone. And I explained to her that, it was actually kind of a little bit awkward to go out to the neighborhood at that point and explain to them about this wonderful hospice care. However, to this day, here I am 10 years forward. After that, going out into the community, absolutely telling them the truth of how my experience is and now how the mission continues. And so I tell you all my friends that are out there on the call that I do not do this because this is my job. I do this because this is my promise to my mother. And if not, she would give me a head slap from heaven. So anyway, there you go. Thank you so much, Helene, for sharing your part of it as well. All right, any other questions?
Let's see. Oh, there is one more.
Okay.
Lani, you mentioned that hospice care, your mother had hospice for more than 6 months. Did you have to pay any of the benefit costs back, being that she stayed over 6 months?
Oh my gosh, I love that question, because that was totally where her mindset was, and I don't know if you get this, but she was like, you never see a U-Haul following a hearse. So she was really concerned about what if we have to owe the government something. And let me tell you that no, there is no payback to the government. It actually is part of the hospice benefit, in hopes that the quality of life, the respect and dignity that someone can have at their end of days is something that the government does provide. Luckily, at the very end, and it is such a joyous thought when someone is able to live well past that 6-month life expectancy. So I tell you right now, nope, there was no refund back to the government. We kept it all and used it all on my mother.
Awesome. Thank you, Lani. There are no more questions at this time.
Okay, great. Let's see now. Let's see if we can actually change the screen. And no, there we go. Okay, so a lot of times people will tell me, all right, well, who qualifies for hospice care? You know, my dad is really sick. But there's just really 3 basic criteria to it. First, the person is dealing with some type of terminal illness, and their doctor, their primary care doctor, or maybe their specialist makes the best guesstimate of 6 months to live. And when I say best guesstimate, it's like Helene said, nobody has the crystal ball on this. They're just saying that, yes, that could be a possibility. And so as a result, though, when they do that, we immediately now give the patient and family access to this wonderful care. So whatever the government decided, it was 6 months. So it was just a matter of a number that they chose, and that's it. The primary care or their specialist will make the best guesstimate. Also, it's important to know that anybody that comes onto hospice care will no longer be seeking curative treatment such as radiation, chemotherapy. They're not going through surgery. They're not doing dialysis. So it's important to know that this is the basic criteria for being qualified for hospice. So further to this, is there a question?
There is.
Okay.
What happens if they do not have a primary care physician?
Helene, would you like to answer that one?
Absolutely. So the great thing about hospice is it's one of the things that I tell people is hospice is what's gone right with healthcare. And that was actually a part of the formula, is knowing that some patients are not established with a physician. So hospice has physicians, and should the family and the patient choose to have one of our physicians care for them during this next 6 months, that is a possibility and actually a part of our formula, so to speak. So that is absolutely a great question, and it is okay, and we will take care of people.
Awesome. Very good. Thank you. Thank you, Tish, for that question. That was great. Thank you, Helene.
That was from our panel. Thank you.
Hey. So other physical things that people can see, they don't need to have a doctor tell them whether or not it's time for them to have hospice care and support in their home, is if you notice that yourself or a patient or a loved one is going to the emergency room quite a bit, or calling or needing help from their doctor. But in addition to that, they are already, their appetite is being affected. They're not eating as much. They're losing weight. They are very unsteady. So as a result, they may have increased falls at home or outside the home. They tend to want to stay in their beds, or maybe just sit in their wheelchair most of the day, so they don't get up or out. In fact, it's very difficult for them to raise themselves out of bed, and so they can't get out of bed or out of a chair without assistance. Most of the time they're sleeping, or sometimes it's so difficult for them to even stay awake for moments of time. And then there's a notice of their skin thinning quite a bit, and them dealing with different types of infections, not only on their skins, but throughout their body as well. So these are things that are happening physically, and families and patients can actually see that this is happening, and they would definitely want to check in with their doctor or call us directly so that we can support them out at home. Our care for hospice is provided at home, and it includes the medications that are connected to the diagnosis in which they were qualified for hospice care. Their medical equipment and access to cares 24/7 is also included as well. And people may keep their primary care physician if they wish. Many times a primary care physician will yield to our medical director, and we will keep the primary care physician updated throughout the process of the care that the patient has with us. There is a care plan that is created for the patient. Everything is so patient-centered because, again, we're trying to service everything, the whole patient, and include the family as well. So the plan will take into consideration the needs and wants of the patient, but also engage the family in that as well. For some patients, dealing with all of their symptoms at home is not possible. And so during those moments when something like that happens, then they could come to our inpatient care center, which is Hawai'i Malama. And this is for times where a patient is dealing with symptoms that are out of control. They can't be controlled at home, and therefore they come to our inpatient care center. As soon as we're able to manage those symptoms, if a patient is well enough, then they will go home to their loved ones. If not, they will stay with us, and most of the time they will pass with us there at Hawai'i Malama. The stay is relatively short. It's not like a long-term care facility such as Life Care Center or Halea Nui Nui. At Hawai'i Malama, people will stay on the average maybe about 14 days, where they will either go home or they will pass there depending on what their situation is. What's a very important point to know is that Medicare does cover the services of hospice care. However, the room and board is not covered under Medicare. So most people who have Medicaid will have all of their room and board covered at that time. And so I always like to bring that particular point up because there's no better time than now to figure out whether or not a patient or family member needs to be covered by Medicaid or is qualified to be covered by Medicaid, because the application process does take some time, and it's good to have that done all in advance. Normally, those who are on Medicaid qualify because of their very low income or no income at all. Now, what is blindsiding many seniors is that they may be living in their home that they own, or they may now be living with their adult children, but still hold the ownership to their home that may now be rented, or other family members live in it. It's a very good time to look at the assets that one has, because if a senior needs to have Medicaid, maybe moving the ownership of said house over to an adult child will make the best sense, so that the senior can then qualify for Medicaid. So this is something that I like to bring up so that people are aware of this planning that could really save a lot of stress for the family should a crisis occur. I wanted to defer just quickly to Helene. Helene, can you share with us what might be a few symptoms that will cause somebody to come to our inpatient facility?
Thank you, Lani. Yes, so a few symptoms that you might want to stay at Pohai Malama could be restlessness, pain that is just too much to bear, and maybe not responding to treatment as well. It can be a number of things, such as maybe agitation, or even things like, to speak plainly, there are symptoms related to the bowel area, so uncontrollable diarrhea, or even wounds can also be another area for patients to come into Pohai Malama. Thank you, Lani.
Thank you so much. I just would like to, again, emphasize that hospice care is covered 100% at home on Medicare. Also, all of the other insurance companies do provide a hospice benefit as well. Medicare, United Healthcare, Veterans Administration, HMSA, they all do include a hospice benefit in there as well. Now, again, if somebody needs to go to a long-term care facility, room and board is always separate from the hospice care benefit. Okay, I think, did you already share that brain teaser with us? Oh, I think you're muted, Tish.
Sorry, Lani. Yes, we did do it during Helene's questioning, so we can just right past that.
We're just coming to the very end now. And so I want everyone to know that as part of our care team, we have these wonderful trained volunteers that come out and really add to the care of the, I think somebody is not muted.
That's okay, we got it.
So what happens is our volunteers will help really address something that brings joy to the patient. And also just to help the family as well. We will have people that will have a caregiver, and that caregiver needs to take some rest, or they want to go out and do yard work, or they need to go and do errands. We have a trained volunteer that will come in and sit with their loved one while they're going ahead and doing that. Or maybe they just need some well-earned rest, so that happens as well. The kinds of things our volunteers would do is, say somebody was a very avid waterman in his time, and so now that he's at the end of his life, you know, he doesn't get around very much. And so he asked his volunteer if the volunteer can drive him along the coastline so he can look at the ocean. And that is definitely something that one of our volunteers would do. Or, you know, when people are in their end of life, sometimes they feel that there's so much of their life that's no longer within their control. And so a simple request such as, can my volunteer drive me to Walmart so I can choose the type of toothpaste I'd like to use? Could that happen? And absolutely that can happen. And it's amazing how much joy that brings to our patients that are really just looking for the simple things in life to boost their quality of life at that point too. Our volunteers are just amazing. We also have a bereavement care program as well, and it is supporting all of those who are on hospice care who then pass. The care continuum in which we offer is just incredible with regard to starting by entering in with palliative care and then transitioning into end-of-life care with hospice care, and then having the family cared for after a patient passes is such a beautiful honor for us in our mission to do that. When I think about going and signing up for hospice care, which I said to you is the Cadillac of all services, I think about likening it to a level of service. And when I think about that, I think, what if we were all, you know, ready to go on a flight on Heaven Airlines? Some of us you know, will go at 2 o'clock, others will go at 4, maybe some will go at 8 o'clock. But make no mistake, our destination is already clear and we're already going to go on that flight. Well, what I found is all of those that are in hospice care for whatever reason, they signed up, they wanted it, they knew about it, etc. All of those patients and their families that sign up on hospice care go onto the aircraft and go directly to first class. And the reason they go to first class cabin is because that's where all the comfort is. That's where all of the comfort is going to be, from the beginning all the way to the final destination. And sadly, for whatever reason, that the rest of the people that come onto the flight who did not sign up for hospice care because they were afraid or they got misinformation or nobody ever told them that there was something as wonderful as hospice care. Sadly, those patients and families don't even go to the main cabin. They actually go to the baggage compartment of the flight. And the reason they go there is because that is the roughest, hardest, coldest ride all the way to the end. And it is such a horrible ride. And what ends up happening is the patients are taking all the family with them and they're all in there. They make it all the way there. Their loved one passes over the bridge and they have to come back on that horrendous flight. And we come in on bereavement care and do our very, very best to pull all of those pieces back together, because many, many families will break into a million pieces because they did not have the hospice care with them from the beginning of the journey. And it's already included where they didn't have to pay anything at all. So it just boggles me why somebody wouldn't sign up for that in advance. But this is the reason, is should somebody miss signing up, we will still be there to help you. And we will also help those that were not on hospice, meaning those that were in the community that maybe a tragic accident occurred, maybe there was a loss of life that was unknown, meaning suicide or some horrible situation. We have our community bereavement that we meet with at no charge for people to come within our community to get that support. And so that's something that we offer weekly, and we'll be doing virtual meetings coming up very soon. All of those who have hospice care, they will automatically receive 13 months of bereavement care and support after their loved one passes. And so this is our mission. We've been talking about it through the entire presentation. I wanted to focus on our service area, which is from Lapahoihoi Point all the way to South Point Ka'u. And all of the areas that are in white on this map are all of the areas that are being handled by Kona Hospice as well as North Hawaii Hospice. And all the colored areas are all of the areas that we are providing care to. And so now we're at our final part, which is let's ask Helene. I don't know if there's any more questions for her, Tish, but let me know.
There isn't currently right now, unless somebody is calling in, maybe would like to ask a few questions. I'll give a few moments for that.
I'm so excited with the amount of questions that we got on this presentation. Helene, thank you so much for joining us on this. It's just been incredible on all of the information that you've been able to provide those that are on the presentation today. I wonder if for those who didn't understand about palliative care, if in fact they understand about it now. Is there anybody out there that still may be a little cloudy on what palliative care is and why it benefits everyone? Anyone?
I did get a comment that said, wonderful presentation. Mahalo nui, Lani, Helene, and Tish. Thank you so much, Andy.
That's awesome. Okay. And so we are going to, Okay, go ahead.
So sorry, Lani. While you have that up, we do have 4 more minutes left in our presentation. I do have one more poll that I would like to put up on the screen as a end of presentation survey. These answers will not be shown, the results will not be shown up after. However, if you would please take this few minutes to just answer a few questions, that would be wonderful.
Tish, would you like to check in on a takeaway before you put this up?
Oh, sorry. I can, let's see, I will leave this poll up since I just launched it. I apologize. And let's go, we could go around.
Okay.
And if you're comfortable, we'll go ahead and unmute you, and we'll just take a few brief seconds if you can give us one takeaway from the presentation. So let's see. Dr. Hartman, would you like to share one takeaway? Oh, hold on. My unmute button is not working at this time. I'm so sorry. Are you oh, there we go.
Okay, I unmuted myself. A wonderful presentation. The takeaway that I want to emphasize is that I think people wait too long to sign up for hospice, thinking that it is a last-minute parting gesture. And the fact that you do have the 6 months, a lot of benefit can be occurred during that time. But Lani and Helene, a wonderful overview of the services. Thank you.
Thank you, Dr. Hartman. Thank you.
Thank you so much.
Thank you.
Okay, let's see. I am going to go down to A. Gomes. Hello, you are unmuted. Would you like to share a one takeaway? Oh, maybe not. Okay, thank you for attending. Amelie, hi, would you like to share one takeaway?
I always learn something new from Lani, and I just enjoy the passion that you bring to the organization and to Hawai'i Care Choices, and teaching the community about palliative care. I always learn something new.
Thank you so much.
Thank you, Amelie.
You.
Okay, we have one more minute. Let's go to Angelina. Hi, Angelina, how are you? Oh, hold on, I'm just gonna unmute you. There we go. Hi, Angelina. Okay, thank you so much for participating. All right, let's see. Brenda, I'm gonna unmute you. Hi, Brenda.
Hello, wait, am I on?
Yes, you are. We hear you.
You can hear me now, you can see me. Yay!
Yeah.
I am so honored, and I say this a lot, but I truly mean it from the heart of the commitment and the work that so many people are doing within Hawai'i Care Choices. Our board of directors are fabulous team that's promoting us and what we're trying to do and to live up to our mission and vision. So I think I just want to say thank you for doing this. Thank you for allowing me to see your presentation. The other thing I'd just like to say is the message that you folks are giving is that you just call Hawai'i Care Choices because there might be opportunities. Sitting and trying to figure out where we can help you or where you're at in your situation sometimes it prevents or causes a barrier to you reaching out. So if I had a message for anyone, and what I heard clearly from the Helene and Lani and Tish and the presentation that they've just offered us, is that just call us. We exist to help you. And so if you just have any questions or need any help, give us a call at that 969-1733. That sounded like an infomercial. We're here for you. Thanks.
That was perfect, Brenda. I had it on the screen. Very good. Thank you.
Thank you so much. I'd just like to say that it is 11:32. We did want to end right on time, so we apologize for going 2 minutes over. We also want to say sorry for those of you that we were not able to get to on the takeaway, but please, if you would like to, leave us the comments either in the polling or you can email us at care@hawaiicarechoices.org. And you can share your comments in length if you'd like to, or just a little word. But I'd like to say again, thank you, Lani, for doing this presentation. Thank you, Helene, Clinical Director for Hawaii Care Choices, for being our guest speaker today. And again, thank you, everyone who participated. Thank you so much. Lani, is there anything, your last words?
No, I think it ended really beautifully. I look forward to seeing what everyone's final thoughts were, and I'm so honored and feel happy that people were able to join us today. So I hope the information that we provided will help, and I look forward to helping you folks more in the future. Aloha, everyone. Thank you so much. Aloha.
Mahalo. Aloha.